Hi, welcome. My name's Pete Sandworth. I'm the SIM facilitator for the Trust. And we're going to meet the mannequin. Let's get started. So starting with his head, as you can see, if you wait long enough, you'll see him blinking. He blinks away nicely. His eyes can be open, they can be closed, they can be half open to kind of simulate his level of consciousness. So watch out for that when you're doing your scenario. His pupils can be made to react to light. They can be equal, they can be unequal. So it's worth having a look at them when you're examining your patient just to get an idea what's going on with those. So his airway, essentially he's an anaesthetic mannequin originally, so his airway, you can do everything you would like to do with an airway really. So you can intubate him, you can put laryngeal masks in, you can ventilate him via a bag valve mask, you can put oropharyngeal airways in, nasopharyngeal airways in, and if we have to, we can do front of the neck airway management as well. So his airway is fully functional, and we can make it more difficult to intubate or less difficult to intubate depending on the scenario that we're doing. You can see that his chest does move up and down. It can be sometimes a little bit tricky to see, so my general advice is if you are looking at his chest and you want to see how well it's expanding, you can put your hands on his chest like you would do in a normal patient. So if you put your hands on his chest here, you can see my hands start to move up and down. The chest movement can be equal, it can be unequal, but it can sometimes be difficult to see, so it's worth having a look at. In terms of his auscultation, he's got speakers in his chest. So when you're listening with a stethoscope, you need to be in the correct place in order to hear where the breath sound's coming from. So the speakers are in the front of his chest here, and they go down and then into the bases. And he'll have heart sounds approximately here. But we'll show you a little bit more of that later, where we'll show his inside working, so you better see those speakers. He's got chest sounds on the front, so his anterior aspect, but equally you can sit him forward and you can listen to the posterior aspect of his chest as well, so he's got speakers on both sides. His respiratory rate is in time with what it's set to, so you can stand and count his respiratory rate. Equally, it may be shown on the monitor that you'll see behind us in your scenario. Percussion note, so if you're going to examine his chest like you would do normally, the percussion note is always going to be dull because actually he's a plastic mannequin, so that information might come from the plant within the room, might give you a bit more detail on that. So in terms of circulation assessment in your mannequin, in terms of how you might do that, we can start with pulses. So he's got radial pulses, and he's got all his peripheral pulses, and he's got central pulses. The pulses will be generated and they're based on blood pressure. So if his blood pressure's in his boots, don't expect to find a radial pulse. So very much when you're looking, you're monitoring and you're feeling your pulse, and put the two and two together. So from a radial pulse point of view, on real people you would normally feel a little bit lower here, but his pulse point is just a little bit higher here. And really the way of detecting any of these pulse points is to kind of feel a bit around the hard plastic, and when you can put your fingers in a little divot, that will be where the pulse will be. So the idea is you press on it and just to keep a gentle pressure, that keeps the mannequin talking with the pulse and making sure it keeps generating that pulse. If you press too hard, you'll totally occlude it and you won't feel anything. So just a nice gentle pressure on there, and that should be fine. So that's his radial pulses. He's got carotid pulses both sides, and again, these can be quite tricky to find, but then in real people they can be tricky to find. So it's where you would normally expect to find it. So the same applies there. Press, keep a gentle pressure, and you should feel the pulse. Femoral pulses, obviously where you'd find them, and if you're looking at the mannequin, you can see quite clearly the pulse points here. Put your fingers into the pulse there and you can feel the pulses. And then he's got lower limb pulses as well, so he'll have distal tibial pulses and dorsalis pedis pulses, and he's also got a popliteal pulse on his left leg. He's got a cannula in there currently, and not very often in most of the scenarios that you'll be presented with, he will have a cannula that's working and flushed, and we'd expect you to use it like any other cannula. So you can see that if you just pop this in here, and then you push the fluid, he will flush nice and through. And so you can tell him, Brian, I'm just going to give you a small injection here, just to make you feel better. It's just some antibiotics. So you can see that the cannulas flushing through nicely there, and that's just going away into a collection bag, which you might just be able to see in shot here, which is made up of that. This is not anything to do with your scenario. This is just a way of us collecting the fluid that we're putting in. So that's the cannula. So in terms of assessment of the Manikin as well, so we've talked about pulses, and we're going to look at monitoring. You can put a blood pressure cuff on him, and we can get a blood pressure monitoring on here. And depending on the scenario that we're running, we may have an arterial line in there, so you'll have that monitoring on the screen. But as mannequins go, he can sweat, but we don't often make him sweat, but he will always feel like a plastic mannequin. So some of the fidelity for the scenario will come from the nurse within the room. So if you're thinking about doing capillary refill time, we expect you to do things in real time as you would do in reality. So you would press for 5 seconds, you would release after your 5 seconds, and then you would hope you would get the information from the nurse within the room. So the idea is being that, you know, the pallor, the way he looks, will come from the nurse within the room or the plant within the room, whoever that may be. And one of the functions that we're just displaying to you now is the fact that he's having a clonic-tonic seizure. It's not as you would expect in a real patient. His limbs tend to shake, and often he'll close his eyes and he'll have a bit of a clench down in his jaw, but you can see quite clearly that his arm is shaking here. So if you see this kind of motion when you're in your scenario, then he may be having a seizure. It's worth investigating that. As you can see, we can also make him bleed. So we're just going to have a little talk about the monitoring that you can use with SimMan and what we've got in the room here. So just on the screen, you've got a touchscreen monitor. It may not be what you're used to, but it'll be what will be in the sim room for you for your session. And so it's fairly straightforward to use. You just apply the monitoring like you would do normally. So I'm just going to pop the SATS probe on. So I find the SATS probe on here, and then I'll pop it on his finger. The SATS will start to come up on the screen there. You can see that he's got saturations of 97, so that's good. Then I'm just going to apply his blood pressure cuff. Just going to put this cuff on your arm, Brian. So he's going to get a bit tight. So just pop it on your arm there, as you would do normally. It ties up around there. And then once that's connected, I touch the screen, and then I'm going to press the start-stop button. And the blood pressure will come up in its own time. While that's going, I'm just going to pop some ECG leads on his chest. So, usual configuration. Ride your green bike if you've got 4 leads. That one that just pops on down the chest down there. And then you touch the screen and the ECG will come up on the screen there. So that's got our monitoring up on there. When you've got the blood pressure cuff on, touch the screen to tell the machine that you've got it on there. And you can stop, you just get a one-off blood pressure, or you can set it up automatically by pressing the numbers and then arrows down. Repetition time, where you can set that whatever time you want. So let's select 3 minutes, for instance, and then press auto, manual, make sure it says auto on there, and you can close that down. So in 3 minutes time, that blood pressure is then just going to cycle again, and that takes the thinking out of it a little bit. This monitor can be changed, so we might have other parameters on there depending on the scenario that we're using, but we've got the basic configuration at the moment. So you've got 3-lead ECG, saturations, non-invasive blood pressure, and we can bring up end-tidal CO2 if we've got to the point of intubation. And you can see that on the screen here, the respiratory rate is being counted for you as well. So we'll just talk a little bit more about what other functions of the Manikin as well. So I want to talk about his abdomen a little bit. So I'm just going to lay him flat. So Brian, I'm just going to lay you down for a second. We're just laying him flat, and you can see that, I mean, as he's a plastic mannequin, his abdomen is always going to be soft. It's never going to be rigid or distended, but it does have speakers in there. So if you are interested in listening for bowel sounds, then you'll find that the speakers are in the 4 quadrants. So you'll find a speaker roughly about these places here around his umbilicus. And so you can go ahead and listen with the stethoscope, and you might get some different bowel sounds on there. As we're talking about other functions there, he's fully catheterizable, so we can put a catheter into him. He may well have a catheter into him as part of your scenario, but we are, as I've already said, really, we are encouraging you to do things that you would do in real time. So if you need to do a catheter, then we expect you to get a catheter trolley and prep it properly and talk him through the process. So we talked about auscultation of his chest and where you might hear those chest sounds. So I'm just going to show you where those speakers are inside, so you get a clearer picture about where they correlate to the outside of his chest. So I'm just going to pop back his skin for a second here, and you can see that these speakers on his chest here generate the sounds that you hear. So generally speaking, these are heart sounds, and he's got some breath sounds, some more heart sounds here, but on this side here, but these are a mixture of heart and breath sounds. And then just on the bass down here is his bass sounds. So you'll be able to hear his basal air entry in that side there. Since we've got the skin off here, if you look back on his tummy here, as I was talking about those 4 quadrants, you can see that the speakers are just in these areas here. So that's roughly where you're looking. So I'm just going to pop the skin back over again so you can try and map those. So air entry about here into the basses, heart sounds here, and then up on there, and these bowel sounds just in there.